Hello and welcome to the Federal. Today I'm joined by Dr. Rohan Krishnan, President of the Indian Medical Association, who is here to clear the ambiguity around the monkeypox disease, for which the center has recently issued a set of guidelines to the states and union territories on how to tackle it best. So, Dr. Krishnan, how real is the monkeypox threat in India, for which not a single case of the disease has been reported till now?
See, right now we are not in a bad situation because right now we haven't been reported any of the cases of the monkeypox. But one thing which is rightly said and taught in case of pandemics and epidemics, that it is not a matter of is it going to happen or not. It's not a matter of yes or no. It's just a matter of when it is going to happen. So obviously we have to stay alert. But at speaking presently, as per we are seeing the situation now, it's better to be watchful because we have learned a lot from the past pandemic. But still, right now we don't think that it is going to become something very dangerous or a COVID-like situation in India.
What preventive measures can be taken at the community and individual level to ward off the disease?
This is a disease which was particularly seen in African regions, and because of the traveling people who went, international travelers, it has now spread to around 20 more countries, including the United States and United Kingdom. So, first of all, we have to curb the disease. We have to detect the disease at the very basic level. That is, it is going to come via the international traveling because it is a type of disease which can be affected only through two or three things. Firstly, it is going to affect if someone is bitten by a rat, an infected rat or rodents, or someone who is having a goose meat which is affected by the disease. So these two things are not common in India. We are not of that kind of appetite. Mostly, we don't. Nobody eats rats and rodents here, and so that transmission is less common. The second part of the transmission is that is the human to human transmission. We have to check and measure the curves over there because it can be transmitted via the droplet infection, via physical contact also. So whenever it is going to happen in someone, they are going to have a very vesicular rash, a big rash, and like smallpox like rash on the face, on the entire body, but most commonly on the face. So isolation becomes the first and the foremost preventive measure, and then comes our N95 mask that we have to wear all the time, and we have to follow the social protocols. We have to adapt to the new normal because with the globalization and with so much frequent traveling between one country to another, it is important that we follow the steps and the measures that is being the social distancing, of sanitizing your hands, of washing your hands with everything you touch, which might be contaminated. So these things should be a part of lifestyle now, and I think that these measures should be followed for prevention of the disease.
But, Doctor, what about the virulence and fatality levels associated with monkeypox? Are they dangerous?
Monkeypox, as per this is a DNA virus. I'll just briefly try to explain you our viewers about this. The DNA virus has a double-stranded nucleic acid in their cells, in their genetics. So these viruses do not mutate, which was the major problem with the COVID virus. That was an RNA virus. They mutate. That is, they change their shape, they change their structure. So once you try to create a vaccine, once you try to create a drug that will be effective on a particular structure, the structure changes itself, so the drug becomes inactive. That kind of thing, by God's grace, is not seen in monkeypox. Monkeypox is a DNA virus, so it will not have mutation. We don't have mutation. We all are also made, humans are also made up of DNA, all the cells. So that mutation factor is not there. So it becomes a very big thing for the scientists, for the drug experts to create the drugs regarding this. And the fatality rate is also less in compared to COVID. It's 3 to 5% globally, and with India not being affected at now, so we cannot say that. And also, we another good thing about this is that Indians have a better immunity. So I think that this 3 to 5%, which is the global record, this record of fatality will be much less when we'll compare it to in Indian citizens. So it is not. It's not going to affect the health of the deaths and the hospital beds rates as we have compared with the COVID.
Since you just spoke about COVID, this disease has come at a time when COVID still persists. So, will the prevalence of COVID make handling monkeypox difficult?
Yeah, definitely. This is one of the most important things that we have to be aware of. Right now, we have not gone through the phase of the COVID. The COVID is still prevalent. So timing is very bad. And we have to also understand that since one is an RNA virus, one is a DNA virus, we can get double infection, that a person who is suffering from COVID gets monkeypox or vice versa. So that will be very pathetic situation for the country. That will be very difficult to manage as well. So it's better that this time we move vigilant and we not let it enter into the society. We do not let any of the foreign travelers who are having such kind of symptoms, who are having these rashes, who are having fever, we have to screen them out and isolate them in such a manner that they do not let us into the chain transmission phase again. Because once the chain transmission phase starts, this fatality rate of 3 to 5% could increase to 10% because we are not yet been over with the COVID, because we are yet struggling with the COVID. If you speak 1 year, just 1 year back, our positivity rate was more than 20% in Delhi itself, and majority of the citizens of the Delhi were having COVID. So we don't know the long-term complications which were associated to COVID. And if such complications, another viral impact comes here, especially in Delhi, Mumbai, in big cities, it will become very difficult to handle as well. And it will lead, if not pandemic, it will lead an endemic, which will be lethal. So anyways, we have to save lives. It does not matter the number. Even if it's not 1 lakh, even if it's 10,000, it's a big number.
So my last question to you would be, what lessons can we take from the monkeypox spread in other countries and how it is being handled there, and handle the situation at home?
See, first of all, one lesson that we have to see and take is that we have to create an eco-friendly environment in our community. These people are following the foreigners are following the ancient beliefs of Indian people that we don't eat meat. We have to eat properly cooked meat, and all these frozen items. These things are being now discarded over there. But we are on the phase that we are accepting the frozens, we are accepting the less cooked meats, and we are accepting non-vegetarian food more. So that phase has to change. We have to change our mentality at first to get a globally eco-friendly society and an eco-friendly system and environment. Secondly, one must understand that with globalization, with so much traveling, there is a responsibility among the citizens that also arises, that once you feel that you are being having the symptoms, you are having fever, you are having scratchy throat, you are having some kind of pustules, rashes, then you must report it yourself rather than someone identifying. Obviously, people are wearing masks. It's difficult to identify. It's hard to screen each and every one of them. Doctors are not sitting there to screen. There are layman people, less trained people who are going to screen you. So, as a responsible citizen, if you are affluent enough to travel international, I think you should be wise enough to isolate yourself and inform the authority. Thirdly, we have to have a society where we understand that mask is normal. It is new normal. We have to wear it. Proper sanitization of our hands, proper washing of our hands. These things has to be accommodated and accustomed in our lifestyle because of globalization.
Thank you, Dr. Krishnan, for speaking to The Federal.
Thank you so much.
For more such videos and interviews, log on to thefederal.com.